What if anatomy and physiology stopped feeling like a giant list of disconnected facts and suddenly started making sense? Because for nursing students, that is usually the real problem. It is not that A and P is impossible. It is that the body is taught like 1,000 separate pieces, when in reality, it is one system constantly trying to maintain balance. And once you see the body through 5 key angles, everything starts to click. In this video, I am going to break down 5 angles that make nursing anatomy and physiology way easier to understand, remember, and actually use in clinical practice. Not just what the organs are called, but what they do, why they do it, what happens when they fail, and how nurses can spot the signs early. Let us get into it. First, structure follows function. This is one of the most useful ideas in all of anatomy. The shape of something tells you what it is built to do. For example, red blood cells are small and flexible, so they can squeeze through tiny capillaries and deliver oxygen everywhere. The lungs have millions of tiny alveoli because a huge surface area makes gas exchange fast and efficient. This matters in nursing because once you understand the structure, you can predict the function and sometimes the problem. If lung tissue becomes stiff from fibrosis, breathing becomes harder because the structure is no longer supporting gas exchange properly. So instead of memorizing random facts, ask, why does this look like this? Second, the body is always trying to maintain homeostasis. That means it is constantly balancing things like temperature, blood pressure, glucose, pH, and fluid levels. And here is the key. Symptoms often appear when that balance starts slipping. For example, if someone is dehydrated, the body compensates by increasing heart rate and conserving water through the kidneys. If blood sugar drops, the person may become shaky, sweaty, and confused. This is useful because nursing is often about noticing compensation before collapse. A patient with sepsis may still have a normal blood pressure at first, but a rising heart rate and fast breathing can be early clues that the body is struggling to keep up. So when you study, do not just ask, what is normal? Ask, what is the body trying to protect? Third, think in terms of flow. Blood, oxygen, nerves, hormones, fluids, they are all moving through pathways. This is huge because many clinical problems are flow problems. If blood cannot flow properly, tissues do not get oxygen. If nerves cannot send signals, muscles do not respond. If urine cannot flow out, pressure builds up. A concrete example. In heart failure, the heart may not pump effectively, so fluid backs up into the lungs or legs. That is why patients can show shortness of breath, edema, and weight gain. If you think in flow, symptoms stop looking random and start looking connected. That makes assessment much more logical. Where is the block? What is backing up? What is not getting through? Fourth, the body is controlled by feedback loops. The nervous system and endocrine system are like the body's communication networks, constantly adjusting things in real time. A simple example is blood glucose. After a meal, insulin helps move glucose into cells. Between meals, glucagon raises blood sugar if it drops too low. That push-pull system keeps the body stable. Why is this useful for nursing? Because many medications, diseases, and symptoms make more sense when you see what control system they affect. For instance, steroids can raise blood glucose. Beta blockers can slow heart rate. Diuretics can change fluid balance and electrolytes. So nursing is not just memorizing drug effects. It is understanding which feedback loop you are influencing. Finally, the body gives clues before it gives collapse. That is one of the biggest advantages nurses have. You can spot subtle changes before they become emergencies. A mild increase in respiratory rate, a small drop in urine output, new confusion, pale skin, slight swelling. These may look minor on their own, but together they can point to a bigger problem. That is why anatomy and physiology matter so much in nursing. They help you interpret signs, not just collect them. If you know how the body should work, you can recognize when it is not working right and act faster. So here are the 5 angles again. Structure follows function. The body is a balancing act. Think in flow. Understand control systems. Watch for early warning signs. If you study anatomy and physiology through these angles, it stops being pure memorization and starts becoming a framework for real nursing judgment. And that is the difference between just learning the body and understanding the patient. Nursing anatomy and physiology. 5 key angles that make everything click is just one small part of anatomy and physiology. If you are interested, our full free anatomy and physiology course is linked in the description.